It's a disorder that is very interesting, and the more you learn, the more you realize you don't know.
Most important thing one can say about defining autism would be to admit that one doesn't know what it is. It is confusing.
I didn't know what autism was. I had no clue about the disability, but it was like something's not right. He's just not talking, he's, doing some things that, are different. I thought maybe he was having seizures because he was staring out at the light sources or looking out the window, that kind of thing, and didn't respond. I thought maybe he couldn't hear. Philip was very easy delivery, came on my due date. He seemed to have such normal development, reached all the milestones. It really wasn't until 20 months that he just seemed to be more aloof, and he just appeared like he was just not hearing you. He did have some speech, and then it seemed to subside, and we just lost it.
When Troy was born, we didn't have a clue that there was a disability. Up until age 5 months, I would have said 23 years ago that he was just fine and just normal, but we look back on it and he was very quiet, very good baby, which makes you look now and say, hey, what was that about? But at age 15 months, he had stopped talking. He had developed his speech just like a regular typical child, but he just stopped talking by 15 months.
There's a proportion of children with autism who actually, between 12 and 24 months, around 18 months, actually show a regression or decline, where the child is, if not normal, doing reasonably well, and then the bottom drops out. Over several weeks, they develop some very odd behaviors and features, and then qualify for a diagnosis where they wouldn't have early on. That regression is very puzzling.
I talked with my doctor, and the only thing he knew of at that time was the school system. Well, Troy was 15 months old, and the school system could not service him till he was 2. We didn't know it was autism. So therefore, I became this person who was taking little notes on him, what he was doing, so that I could diagnose him and see what his disability was.
The language skills didn't come quickly. He was relatively quiet. He didn't cry a lot. Very little eye contact. He really didn't speak until about 7. And the first word, we'll never forget it, was "damn it," that he ever said. But he knew when to use it too, because he was trying to put something together and it wouldn't go together. And there was someone with us, and this lady said, "You should punish him." And Mother said, "I don't care what he says. If he says anything, he can say what he wants to say."
As a parent of a child with disability, you have to do what you have to do. Educate yourself. My first career was that of social worker. So I went back and got my master's. So everything I do, seriously, is with him in the back of my mind. So that's why I changed my career. All for Troy. Everything I do is for Troy, but I'm helping other children also.
Well, Fielding was in a special school, one-on-one with the teacher, literally living in the room, 24 hours. And he was coming up to the level of 12 years old, which went into the teens that the school couldn't handle. Mary Andrews was his teacher. And Mary called my parents and said, "I think I can do more with him out of the school if you will allow me to have him live with me for 2 to 3, maybe 4 years." And that's exactly what she did. And she would do geography, mathematics, and writing, and reading, 4 to 6 hours a day, not only just the education, but the social skills to be able to function in society. And she did it. And I mean, she didn't have any fancy books. She just knew people, and she knew these children.
Eventually, I took him back to the doctor, and we went to Children's Hospital, actually. And a pediatric doctor and a developmental specialist, did a battery of tests, lasted a couple hours, and then they, told me that They felt like Philip had infantile autism. I think I was in shock for a while. I remember I was working out quite a bit, and I remember going on to the fitness center to work out and just being kind of there, dazed, kind of went through the motions. I think I probably was in shock for a couple of weeks. You're learning about the materials or about autism from reading things on the internet and whatnot. And then you go through the anger and a little bit of denial because they must have got it wrong, and then you're back in, no, they're right, he is, I knew something was different. I just didn't know what it was. And there's no visible outside physical features to tell you that maybe there's a severe communication disability.
When Troy's teacher said to me, has Troy been evaluated for autism? I had read everything, looked at everything, and that was about the one thing I had ruled out.
And it has had a dramatic impact once we were informed specifically. And even before that, us knowing that there was something not right with Troy, his older sister and brother, well, really all of us began to rally around. He became sort of the focus in the household. He got more attention than the norm.
It was really not until about 12 years from now back that they took him somewhere else to another doctor. And he very quickly said Fielding is, it's autistic. But that was the first time that we really knew exactly what that was. And that was not but so long ago. Just getting over the diagnosis takes a while. For somebody, we had been used to it for so long, when it came out, said, oh, that's what it is? Well, we've already done it.
Shadow is my cat. Shadow is cute and he's adorable and he's my boy. I love you, Shadow.
The perceptions that children or adults with autism aren't affectionate and they can't love you and that kind of thing.
I love you.
I love you.
That's kind of a myth that I think people need to understand, that everybody wants to be loved and probably wants to love back, and he's very capable of loving.
The social world is so difficult for people with autism to navigate, and we really need to reinforce those skills.
Their need for a routine is imperative. And when something of the unexpected or just a change in your schedule happens, they can have a meltdown. No! It's okay. Philip, it's okay. It's okay. Philip, you need to take a deep breath and just calm down for a minute, okay?
It's not someone just trying to not comply. It's someone who is so frustrated because they cannot verbally say how they're feeling or what their needs are, and they don't know how to do it appropriately.
All behavior is communication. All behavior. Whether you have a disability or not. It's just, if you are bored with a conversation and yawn, turn away, look at your watch, it's behavior is communication.
I think kids with autism spectrum disorders want to communicate and socialize, but they're not sure how. And I think maybe failed attempts have discouraged them or made them feel like they can't, or what's the point, or it's too stressful to try. So I think then it's our job to try to help to teach them and practice and rehearse and teach them how to do it, because I think ultimately they want to.
They could have this really great capability, but if we don't give them a booster in those other abilities to socially relate and communicate effectively with others, then they're going to be at a real loss when it comes to the job market or just the living on their own independently issue.
Well, Fielding moved back home to Pasadena with Mother and Daddy, and he wanted to be in independent living. At this time, he's 22, 24, and he's a man, and he doesn't want to live with his parents anymore. And that makes perfect sense, but it's not always easy to do. And that's very important for that person. It's equally or more important for the parents, because you have to know where your child is going to be when you're not there anymore. And that is the scariest part of the whole thing, is the fear of the parents have. He lived with mother for about 2.5 years. Meanwhile, we were working very hard looking for the independent living, because he was used to it and he deserved it, and so did she. Both of our parents are dead now, but mother knew that Fielding will be okay. And that is, I cannot tell you the compulsion that you have the whole time you're raising that child, because when you know if this is going to be a situation that's not normal, you have to start thinking about how can we handle this after we're gone. And that's the thing that holds over any parent.
When they are in the school system, you don't realize how good you've got it until he entered the world of adulthood. And it's just a different world, because he's 23. We had to face the possibility of getting guardianship, having all his rights taken away from him, you know. And those are tough decisions for parents to make. And we stay up at nights and we talk about, do we do that to him? But there again, we talk about it because that day is coming. You know, that day is coming. And how do you take all of your rights away from your child when you know it's the right thing to do? So we're still struggling with that. It's devastating to think about that we're going to have to do that.
We've tried as much as possible to plan ahead, even sometimes in sadness in our conversations, wondering, you know, what's going to happen.
But we want him to be independent, so we have to have him prepared.
And what autism is a collection of symptoms. It's not something you can take a blood test for and know that the child has autism. You start very early. A lot of the time a parent will notice that the child is just not able to relate to them. They feel a disconnection there.
Autism was first identified as a distinguishable disorder in children in the 1940s. Leo Kanner, who was a psychiatrist at Johns Hopkins, wrote a paper in 1943 that describes a set of kids that he had seen over the course of his clinical experience there at Hopkins that shared a bunch of characteristics and that he felt like represented a syndrome, represented a distinguishable disorder that has come to be what we know as autism.
Because he was a psychiatrist, he was limited in terms of how he could understand it, and other psychiatrists interpreted it psychiatrically as an emotional disorder. Looking backwards, this was one of the really glaring mistakes in medical history of the 20th century.
He talked about some of the parents, many of the parents in his early sample were bright, were professional folks. And this got translated in the literature into thinking that they were uncaring, that they were kind of removed from their kids, that they weren't really very warm. When in fact, probably that's not what Kanner intended.
The psychoanalytic interpretation of autism persisted from the 40s through the 70s, mainly because nobody else had any better ideas.
That point of view caused a lot of pain, and a lot of unnecessary pain, really, for parents of kids with autism. It is universally accepted at this point that autism is a developmental disorder, that we don't really know exactly where it comes from or what causes it, but that it's pretty clear that it's not because of parents.
Given where we've come from in terms of understanding autism, we've made a lot of progress. We can place autism on a spectrum of other disorders, but exactly where it fits and how to define it or diagnose it is kind of limited. We're just learning. Between the 50s and 70s, a lot of children who had been classified as mentally retarded were reclassified as having learning disabilities or language disorders. Into the 40s and 50s, people had used an IQ test, which was heavily verbal. So if a child had a language disorder or a language-based learning disability, they would test out as mentally retarded.
Purple. Say purple.
I can think back and I can recall very specific patients that I saw 10, 20 years ago who I would have said then they had mental retardation. Now I would probably say they have autism.
In Henrico County, we have many classrooms for children with autism. Our programs are based in ABA, Applied Behavior Analysis, and what that is just using the everyday principles of behavior to guide what you do. Behavior principles and applied behavior analysis can be used to teach anyone. We all have been molded and taught using applied behavior analysis. Good teachers use it to reinforce learning. Teachers of kids with autism need to use it more frequently.
Nice job. Very nice. Yeah. Are you proud?
Yeah.
Okay, good. There are a variety of tools that students can use to express their thoughts and ideas. And really, one of the biggest challenges with autism is actually finding which tool works and finding which tool they're comfortable with.
When you meet one person with autism, you've met one person with autism. It's just so multifaceted that you are going to find out that they have a lot of similarities, but they're also uniquely different.
I don't believe that there is one set way to do things. It just takes creativity, research, and trying and not giving up.
And the most important thing we do is to ensure that they have a communication method in place, because as you know, students with autism have really extensive amounts of difficulty when it comes to communicating with others.
The one thing I've learned about students with autism is to never, ever just assume that they're at a certain level or assume that they're not going to make it somewhere.
And we've learned more and more that these children are very bright, very intelligent, and we just have to figure out how to get that out, how to help them communicate that. We had one young man that we've been working with for years, and he had not yet used any kind of a communication device or a communication system. And when they did finally get him to use a system, they realized he was off the charts brilliant, just very smart.
He's using a typewriter to type out his responses, and it was really amazing what this child knew that nobody knew he knew, but they had assumed that he was severely mentally retarded, and it comes to light that he was not, and he's typing out all this stuff and giving all these answers, and just amazing. But there's sometimes a lot of stuff locked up in there that we should not give up on.
This is a communication book that we use for some of our students who are nonverbal, and it's part of the PECS communication system, Picture Exchange Communication System. And what our student does is he looks through the book to decide what he wants, and he'll take the picture off if he wants, to tell us he's thirsty, and he'll put that there, and he'll say, I want thirsty, he wants a drink. And there's all of his favorite things. Each book is individualized for what they like.
So we start with the concrete things, such as requests. You communicate, you get something.
The reason that Troy is able to be who he is now is because of that support system.
You've got to do the most you can with what that child can do, and the hardest thing is finding out what they can do.
Identifying a mild problem in a child under a year of age is almost impossible. The difference between a mild delay and a normal child is slight. However, even a mild problem starts to become apparent, obvious, by late in the second year.
And I firmly believe in early intervention. I feel that if we can find these children as young as possible and start services for them, then 23 years later, they would be even more advanced than my Troy is.
Kids with autism who are doing well are not doing well because we just waited. They're doing well because somebody worked really hard with them very early on. In the kids with more severe impairments, often you will see motor movements like hand flapping, like body rocking, just rocking back and forth, or repetitive use of toys or other objects in ways that are not really functional. The repetitive behaviors for kids with autism are not really tics. They're not involuntary. They are, in fact, doing them probably because they like it, because they are interested in it. And so it's not kind of an outburst that's just completely outside of their volition.
We want the best for our children. We want every kind of therapy because they need a variety of different therapies. We got a letter about that they had an oxygen therapy chamber. So we've been going a couple of times a week, and it's kind of hard to tell if there's any major improvements.
A lot of kids with autism spectrum disorders need other therapies as well. Occupational therapy to address fine motor skill deficits, speech therapy. It's usually not one form of therapy. It's usually a bunch of different service providers. So, maintaining communication with them and working together is always a big part of services.
We work with a number of kids and adults from age 3 through adulthood that are on the autism spectrum disorder. So basically their abilities and their interests and their needs range from one end of the spectrum to the other. Through the division, we provide programs that are purely therapeutic, which means they're based on trying to look at and achieve goals for participants who have different disabilities. And then we have also every program that's offered through the division, from cultural arts to history to nature to belly dancing, everything is accessible to anybody who wants to register. We find that the most benefit we really can achieve is when you go out into the world, you go to a bowling alley, and you're around a typical environment. And then you are trying to find what they can do in that environment. Oftentimes, our participants' greatest barriers are attitudes of the people in their lives. Often we'll talk to the parents after we've had an outing and tell them what we did and what their son did during the activity, and they're just looking at us going, really? With tears. I mean, we all tear. So it's like an emotional breakthrough almost every time.
Henrico County has special summer camps for children with autism and other disabilities, and I was contracted to do music therapy services for these children. A, B, C, D, E, F, G. Everybody learned the alphabet to the tune of Twinkle, Twinkle, Little Star. A, B, C, D, E, F, G. Speech and music are correlated. It's just a natural thing. Some autistic children will sing when they will not speak. Every music therapy session starts with a hello. Philip is here and it's time to say hello, hello. And you can create lyrics that will move a child from one transition to another. Music therapy is unique in treatment because it's very non-threatening. These children have issues with social interaction and communication, and music is nonverbal communication. Gotcha. You may use a musical instrument in teaching, but the ultimate goal would be to enhance their self-esteem, to encourage them to interact with sharing instruments, passing drum mallets from one person to the next. Can we play together now?
Yep.
You can take one and I'll take one.
Yep.
Ready?
Ready? Yeah.
The speech and language development delays and the social interaction issues are the focus of the treatment. Every music therapy session ends with a goodbye. Goodbye.
Bye.
Will you sing to me?
Okay. Goodbye, Miss Kathy. Goodbye, Miss Cassie. We'll see you next time.
Awesome. Thank you, Philip.
Bye.
That was wonderful.
He understands earning money, and he likes to work.
You're going walk and going up the step. What? Did the door hang off? Going down the step.
We're very fortunate to have made the right relationship with Hermitage Enterprises, because for Troy, that is a perfect fit, and we can see that it's making a difference in him. He enjoys getting up, going, he enjoys that sense of independence, and we can tell by how he leaves and how he returns home, that this is something that's going to be good for him.
He probably will be successful in holding a Monday through Friday job.
That's the deal.
Okay, so you have to finish the job doing the leaves,
Yep.
but I'll give you $1 for now.
Yep. Now you got $6.50.
We need to help them adapt to be a productive member of society.
He is who he is supposed to be, and we've tried to use that more as an encouragement to help him to again, to be the best that he can be. And that's all we've asked. We want Troy to be able to do and to be the best that he can be, not comparing him to anybody else for any other reason.
There is no cure for autism because autism isn't one thing. That would be like, let's cure fever, or let's cure infection, or let's cure cancer. Many different kinds of cancer, many different reasons for fever, many different infections. They will all have very different treatments. The best hope in the near future, and near future, we're talking decades, is genetic subtyping. We've got the human genome patterned out. We now need to take all the different signs and symptoms and historical factors in all these kids with autism, and we need to start playing it up against those 40,000 specific sites on the gene pattern as to how they're different.
I don't think there's really any kid that if you try hard enough and really put the right supports into place that can't be successful.
No doubt in my mind he will be a productive member of society. On what level, who knows?
There's no question that we're seeing a much broader range of autism, that the children, many of them, have much milder impairments. And does that mean that they will automatically do a lot better when they're older? We don't know yet. Only time will tell. But there's certainly reason for optimism.
Play together.
Friend, I will remember you, think of you, pray for you, and when another day is through, I'll still be friends with you.
Lovely. Thank you, Philip.
Welcome.